Happy New Year and welcome to HealthWatch, presented by Novant Health. I'm June Baker and I'll be your host today. Today we'll welcome Jason Honecker, who's a physician assistant at Oceanside Family Medicine in Bolivia. He's going to talk to us about New Year's health and wellness. And then we'll speak about gynecologic oncology with Dr. Lindsay Buckingham, and she's from Novant Health Cancer Institute. And finally, we'll chat about nutrition with Nate Medunik from Novant Health Brunswick Medical Center. So stay tuned to learn about all of these topics with HealthWatch. Please welcome my first guest, Jason Honecker, a physician assistant with Novant Health Oceanside Family Medicine here in Bolivia. Jason, thank you for coming today.
Well, thanks for having me.
And you're my very first guest in 2023.
All right.
That feels pretty good.
It feels nice.
Yeah. Well, at the beginning of the year, we always talk about health and wellness. You know, it's one of those things. We all ate too much. It's always a hot topic this time of year. So, we have a lot of ground to cover, so we'll just get started. So research shows that physical health is one of the most common New Year's resolutions. Do you find that in your practice?
Sure. I mean, working in family medicine, I mean, it's a big topic of conversation this time of year. Everybody's got their resolutions, everyone wants to talk about diet and exercise and what they can do to improve their health. So.
Yeah. And tell me, what are some of the important ways that we can take care of our physical health, like regular checkups, things like that?
Sure. I mean, so, and none of this is revolutionary. It's the same information that we've been giving people forever, right? And it's, I think a lot of it is having consistency in some of these things. But, you know, I talk to my patients about proper nutrition, you know, making sure that they're getting a varied diet, plenty of fruits and vegetables and lean meats, trying to stay away from all the junk food as much as we can. It's been a tough time of year for that.
I guess it's something we probably need to do year round.
Yeah, of course.
Not just after the first of the year.
Definitely. Consistency is key. Talking about make sure we're getting good sleep.
Yeah.
I think people discount that a lot when it comes to part of our health, making sure restorative sleep is how our body heals itself. It's
hard to get sometimes. It depends on how busy you are, what kind of work you do.
Sure.
That's really hard.
We're always on our phones, or we've got the TV on late at night. So my patients that are having sleep difficulties, I was talking to them about putting their phone away, you know, turning the TV off an hour or so, you know, before bed. Try reading an actual book.
What is it about the phone that keeps you?
Well, it's got there's some light, like, I don't know if you've seen, they sell like the blue light glasses, you know, to try to filter some of that out. So it can mess with our body's sort of, and our mind's ability to kind of turn off. We also just have busy minds, and I think all the scrolling doesn't help with that.
But I seem to have trouble turning it off. I keep thinking through what happened today, what do I have to do tomorrow, what am I going to wear, what am I, you know, all these.
You know, I talk to my patients about like mindfulness exercises, and you know, our phones can be good and bad. Some of the good things is I talk to my patients about, you know, there are apps to help with like meditation and things like that to sort of calm our brains down at the end of the day. So that's one of the good things that we can do
with the phone
with them. Sure. Exercise, obviously, everybody starts going to the gym, you know, at the beginning of the year. So staying active, you know, very important.
Yeah. Let's talk about preventative care. Why is it important to have a regular physical or an annual well visit?
Sure. I mean, there's a lot of reasons and a lot of benefits to it. I think one of it is with our well visits, we usually try to do blood work, just routine sort of screening labs. Keeping track of, you know, some things that are important indicators for health, like our blood sugar, our cholesterol. You know, we look at check for anemia and our electrolytes and liver enzymes and kidney function, all these things, sort of markers of good health. And some patients already have some issues in those areas, like our diabetics, we're monitoring their kidney function. And then people that, I do have some patients, thankfully, that don't have a lot of chronic health issues. So, we do those labs just to keep check on everything and make sure, that they're staying in the green.
Yeah. Well, I think it's important to have that sort of that boss of all your health care. Being in primary care, you sort of are the coach. And
yeah, I tell my patients we're their home base.
Yes.
We're the place where if they get sick, they come see us first. We manage most of their chronic health conditions, to a point, unless it sort of reaches beyond the bounds of family medicine, and then we set them up with the appropriate specialists. But having a place where they can come once a year and say, here are the updates with what's been going on with me in my health, this past year or in the past 6 months or whatever it's been, so we can make sure that we're not missing anything, and that everything that needs to be done is being done appropriately.
Yeah, and you monitor their or encourage them to get their routine colonoscopies and mammography.
Sure,
things.
that's part of the annual physical as well. So making sure that they're getting those routine, age-appropriate screenings and saying, okay, you're 45 now, right? So they've just lowered the age of colonoscopies.
They just lowered that.
Yeah, from 50 to 45 this year. So we're saying, all right, you're 45, and it catches some people off guard. It's time to go ahead and get the colon cancer screening.
I don't
Not anymore. And doing their mammograms and pap smears and everything, just keeping up with routine health checks. And it's important to do those things. I remind them because early detection of cancers, it always increases the favorable prognosis and treatment outcomes.
Do you get much pushback when you start talking colonoscopies?
Sure. I mean, look.
Not everybody hates the prep.
Yeah, it's always the prep. I mean, once patients go through it, and it's changed, some. It definitely has improved from the old preps, but, I remind them everybody's got to do it. It's all part of it. We can be a community that's gone through the misery together.
Talk to your neighbors. They've all had them.
Yeah.
I think one of the most important topics now since the pandemic is mental health. Let's talk a little bit about that. Talk about resources and how we get folks the help they need.
Yeah.
Do you find more of that now?
I do, yeah. I actually have seen quite a bit more. And it's always hard to know whether or not it's just because people are coming in more and maybe they feel more comfortable talking about it, or if there actually is more. But I definitely have seen more in my office. First step is coming in to talk to somebody about it. And for a lot of people, that's the hardest step.
The hardest step.
Just to say, I know that there's an issue that I need some help with. And once they get in the door and we can have these conversations and I talk to them about different avenues of treatments, there's no one-size-fits-all treatment for anybody, but we talk about things like mindfulness techniques and exercise and proper nutrition and sleep, seeing therapists, sometimes medication, if that's appropriate, if that's what they need, or a combination of all of those things. So we take it on a case-by-case basis. In some patients we set up with a dedicated specialist, for mental health care. So it just kind of depends. But yeah, the first step is getting in the door and talking to someone.
Yeah, I think that's the hardest part.
Yeah.
And I think that people think just because they're having some down days, they think, but we really need to think about it. We're ignoring some of the signs.
And down days are common and normal.
Yeah,
everybody gets them. But it's when those down days are more common than not, or when they are significantly affecting our quality of life, or our relationships with our friends and family and work. And
well, Jason, it's always a pleasure to have you here.
Thank
you so much for being my first guest of 23.
Well, I'm excited.
And I wish you the best in this new year.
Thank you.
Please welcome my next guest, Dr. Lindsay Buckingham from Novant Health Cancer Institute. Welcome, Lindsay.
Thank you.
It's so good to have you here. Thank you for coming today. I know it takes time out of your busy day, but we're really happy to have you here. So I always start with my new guests, with your background, tell me a little bit about where you grew up, where you went to school, and your training.
Sure. I'm a native North Carolinian.
Wow.
Yeah.
One of few.
Yeah. I grew up outside of Chapel Hill in a town called Pittsboro, and did essentially all of my education at UNC, so undergrad and medical school, and then for residency was in Philadelphia for 5 years, which was really great. And then was lucky enough to come back home to UNC for my fellowship training, which has led me up to here.
Wow. Oh, that's great. There aren't that many locals. Sometimes everybody's from somewhere else.
Yeah, yeah.
Yeah, that's great. Tell me about your residency and your fellowship.
Yeah, so when you practice GYN oncology, you actually start as an OBGYN. So for 4 years, I trained in Philadelphia, doing general women's care. So I delivered babies, did gynecology, did a little bit of oncology at the time, but really developed an interest in practicing surgery and taking care of cancer patients. And so applied for and matched for a fellowship in oncology here at UNC in North Carolina.
Wow. So you're qualified to do a lot of things, really.
Yeah. I could still deliver babies if I needed to.
If you had to, yeah. If we had a hurricane and we all got shut down, you would have to probably deliver babies. Now, I know you focus on gynecological cancers. So can you give me an overview of what's the most common gynecological cancer?
In the United States, it's endometrial cancer. It's the 4th most common cancer in women.
Really?
Yeah.
Wow. Are there symptoms for that? Do you know that ahead of time?
Unlike ovarian cancer, yes.
Yeah.
Oftentimes, women with endometrial cancer will present with bleeding, vaginal bleeding after menopause. Most women, thankfully, will get into their doctors pretty quickly, and that will tip us off that there's something to be done. And we often find these very early.
Oh, that's great.
Yeah.
Are there certain risk factors that lead to that endometrial cancer?
Yeah, we know that as obesity has been increasing, especially in the United States, endometrial cancer has been increasing along with it. Anything that can increase your levels of estrogen in the bloodstream would put you at risk for endometrial cancer. Obesity is our big one in the United States, but also never having children is another risk factor.
I know a little bit about the HPV vaccine. Can you talk to us about that and who can get it, the vaccine, and why should they get it?
Well, everyone should get it. And it's really important because both men and women can carry HPV. Most frequently, women have symptomatic or asymptomatic, but cellular changes from the infection. And so it's important because it's sexually transmitted that we actually start vaccinating our kids well before they're sexually active. So these days, I'm pretty sure the American Academy of Pediatrics would recommend, I think by age 9, we start vaccinating for HPV. But for women, previously it was up to age 26. It's a 3-vaccine panel that you complete, and that's going to help prevent the HPV infection, which can lead to cervical cancer. We can now use that vaccine in women up to age, I want to say 45.
Really?
Yeah, and even if you've already got an HPV infection, it's been shown to help reduce the risk of subsequent cervical cancers.
And so when you give them at age 9, that's for boys and girls alike?
Yep.
And what kind of cancer, or does it increase the risk of cancer in boys? What kind of cancer would?
Yeah, penile cancers for men, and then head and neck cancers.
Head and neck. That's interesting. I know that some of the cancers that you've spoken of are caught early, but some unfortunately are caught later. And so can you talk a little bit about the different types of treatments, the treatment options for both early detection and late detection?
Sure. Early's usually fairly easy, so particularly in endometrial cancer, when we can find cancer early, we get to do surgery, and for a lot of women, surgery is all that's needed.
And you remove the uterus?
Correct. Yeah, so a surgery for endometrial cancer involves removing the uterus with the cervix, the fallopian tubes and ovaries. And then in general, we're looking at lymph nodes in the pelvis, sampling those on each side of the uterus. For a large majority of women, surgery is enough. Sometimes a little bit of radiation after surgery is necessary, but usually this is a short course, and it's to kind of make sure that the cancer stays away once you've taken it out surgically. And with ovarian cancer, which is the one that we tend to detect later, unfortunately, we kind of have two options up front. And so with the diagnosis of ovary cancer, you'll sit with your gynecologic oncologist and talk about, should we do surgery first or should we do chemotherapy first? Survival is actually the same.
Is it?
We do know that. But what matters is when you do surgery, you're able to get everything out. And so if at presentation it doesn't look like that's possible, we do chemotherapy first. We usually do 3 cycles. We do a scan and assess to see if we can do surgery yet. If we can't, we can do more chemo. Otherwise, we go to surgery to remove all the same organs as endometrial cancer, and in addition, the omentum and anything we can see in the belly that looks cancerous. Ovary cancer really is managed by chemotherapy, and oftentimes multiple lines of chemotherapy are required during a person's lifetime. But I think the positive is that women are living longer and longer with ovary cancer, even though the stage at presentation really hasn't changed much over the years.
With the endometrial cancer, once you remove all of that, will women have to continue treatment? Do you have to do anything afterwards? Do you take by mouth or chemo or?
For endometrial, it a little bit depends. So for endometrial, oftentimes we're able to just treat with some radiation after the fact. If you have some of the more uncommon but more aggressive cell types, we may treat with chemotherapy. It's usually 6 cycles. Gynecologic oncologists do 6 cycles at a time and kind of assess from there. Ovary, though, before or after surgery, you'll have chemo, and then we just kind of assess for response, and oftentimes women are on chemo for quite a long time for ovary.
Do you work in connection with their other doctors with primary care, and how is that all handled? GYN-onc is very multidisciplinary, so we're really close with our radiation oncologists, and in fact, we have frequent meetings called a tumor board where we discuss our patients, and rad-onc's there, radiology's there, pathology is there. When I do surgery, I often go to the pathologist's suite and look at my slides with them to see exactly what they're seeing in my patient. And so we have close relationships with the other doctors. I also think from a primary care standpoint, it's important that their doctors kind of know what's going on. And so at least at initial consult, we make sure to reach back out and communicate what's going on. And then if there's any needs otherwise, we work together during treatment to make sure that our patients are plugged in. What's been very enlightening having you on the show, you're my first gynecological oncologist. It's hard to say.
It's a mouthful.
Yeah, it is a mouthful. But thank you so much for coming today. I wish you a very happy New Year.
Thank you.
And I hope you'll come back and see us.
Sure.
Yeah, we can talk about your research opportunities.
Yeah, that would be lovely.
Okay, great. Thank you so much.
Thank you.
Please welcome our next guest, Nate Medunik. He's from Novant Health Brunswick Medical Center, where he's a dietitian and a nutritionist. We thanks for coming today.
Thank you for having me.
And so you brought food.
Yes, I did.
Oh, this is going to be a new thing. But first, we want to talk about your role here at the hospital. So tell me what you actually do.
So I'm a clinical nutrition manager, and I'm also a patient service manager, so I kind of got a dual role there. With that, basically, the clinical role, it's pretty much just focused on the patients, finding out where their nutritional status is when they get in here.
Okay.
We talk to them, we find out how they were eating prior to getting in here. find out basically what brought them in here and if it's increasing their nutritional needs. And then we try to focus in on making sure that the interventions are specific to that patient's needs to make sure that they're able to discharge and be successful with the discharge and everything. As far as the patient services role, that's something I enjoy. I get to talk to the patients about the food and everything, and they give me feedback on the food. Yeah, they let me know if it's if
good
they
or
enjoy.
bad, right?
Yeah, they let me know if it's good or if there's any issues, and then if there is issues, we talk to the kitchen staff and we get that squared away in real time. It's the good thing about it is we got a really talented kitchen staff, and they always go and serve really good food and everything. That's what everybody strives for. So.
Yeah, and you know what? They're really nice. I've been a
Yes.
patient here quite a few times, and my husband, and they're always some of the nicest people who deliver your food.
We
And
got a good crew.
They say, "How are you? With is there anything I can do for you before I leave?" I love that. They're awesome. Well, aside from physical health, we know that weight loss and eating are among the most popular New Year's resolutions. And happy 2023, by the way. So, what do you suggest about losing weight? Should that be your dietary goal, to lose weight, or should it be to be a more healthy eater and lose weight more naturally?
It's easy with the New Year's resolutions to get kind of a little out of control
That would
with
be
that
me.
stuff. Yeah, sometimes it's like, oh yeah, I'm going to lose about 50 pounds in 3 months. It's not. It's
Doesn't
not
work like
realistic.
that.
It's going to be a kind of a tough issue. What I always recommend is just try to go and change up the eating habits so that if you eat healthier and it's portion controlled, a lot of times you're going to find that the weight loss just starts happening. Yeah, and then if you're able to increase your physical activity, as long as the doctor's on board with that, it's also going to help out with the weight loss process. And if you go and make these minor changes, it's something that you can go and you expect.
You can live on that.
Yeah, you could expect the weight change with that. Yeah.
Yeah, some of these diets you cannot live on.
No, really can't.
Well, are we going to talk about this food here?
Absolutely.
Well, is this of like food groupings and things like that?
Yeah, I wanted to go and show basically kind of portion control and what a balanced diet looks like.
Oh,
So with this, so we've got some cod here. And
that's codfish?
That's codfish. And this is basically the same plate here. What I wanted to show with the plate was that on a smaller plate, it looks like you're getting a bigger portion.
Now I got it.
And then on this one here, it's basically the same portions, but it doesn't look like as much.
Right, it doesn't.
So sometimes using strategies, just using a little bit smaller plate, and then making sure that you got a balanced diet. We've got the protein in here. That's somewhere right in that area, what you're looking at for the 3 ounces, about the size of a deck. Yeah, about a deck of cards. We've got our starch. We've got our vegetables here. And we've also got our dairy and our fruit. And it gives you an idea on the portion control, portion size and everything. Nice thing about this right here, 400 calories.
Nuh-uh.
Yes.
Oh.
Yes. So,
Really?
yeah. So it's something that you can go and have a good meal, and it's something that you're still going to be able to lose weight.
That's a lot of food.
Yeah. Yeah, and it's healthy. It's good stuff to eat there. So.
And it looks so pretty. But you're right about the size of the plate. That looks like something's missing. And this looks like a full plate that would more than fill me up.
Yeah, any chef out there will tell you the first thing you go and eat with your eyes first. And it's something that if you see a plate with a whole bunch of white on it and then just a little bit of food on there, you're going to feel hungry at the end. So,
I'll be darned.
Yeah.
That is awesome. I can't get over that. That's a big difference there.
Yeah.
When we talk about amounts of fruits or vegetables that we eat, that seems to be, it's hard to get all the vegetables in.
It is, yeah.
So are there any creative ways or strategies that we can use to include, to get more vegetables and fruits in?
Sure. There's a lot of time I try to make it as convenient as possible.
Yeah.
And in this day and age, it's something that we've got all those convenience products. We do got the fresh fruits and vegetables. Sometimes it's kind of cost prohibitive, and sometimes it goes out of season. It's not at its best.
Yeah, it doesn't taste as good as in the summer.
But what we can do, if you go over the freezer section, they've got all the fruits and vegetables over there. As far as with the vegetables, you want to go and make sure that you're avoiding the stuff that has the cheese sauces, the additional calories and stuff like that there, because that's the stuff we're trying to avoid. A lot of times it's something where you can just steam those products off and then go and add them to your meals whenever you're making up your dinner. It's a lot easier to go and have, like, instead of just like some plain rice and a piece of chicken on there, if you could go and throw some, steam some kale off and then have some peppers and onions, you're going to add a lot of flavor to it. You're getting your vegetables in there, and it's something that it's going to be a lot better meal that you're going to enjoy. Put a little sesame oil on top of there, just a little bit, and it's going to go and add a lot of flavor. It's good stuff.
That's my favorite vegetable right there, broccoli.
Broccoli?
I love broccoli.
Yeah, it's really good stuff,
Yeah. Let's talk about a sweet tooth. You know, it's January, and we have eaten all these sweets and all this stuff. So many desserts. That's me. I love dessert. That's all I want to eat. So how much attention should we pay to sugar intake? Is that a...
Yeah, it's something that those sugars and stuff like that, that is something that should be more of a treat. The concern is basically it's additional calories, a lot of them, and it's absorbed really fast. And basically, you're going to have to go and metabolize that stuff. So it's either you metabolize it or else you burn it, or else you start storing it. And yeah, you don't want to get the gut too much. So so basically, trying to avoid that stuff would be a better option. Just limited and with the sweets and everything.
Yeah, I seem to find that I think I get addicted to sugar, and then when that first week or two trying to do away with the sugars and stuff, that's a tough week.
Yes, definitely.
So I don't know how you get over that. I don't know how you get past that. I guess you just have to wait it out.
Yeah, it's one of those things. Just kind of if you're having dessert 7 days a week,
that'd be me.
Yeah, go ahead and just back it down a little bit. Instead of 7 days a week, back it down to 3 days a week, something like that. Yeah. Those little minor changes, it will add up, and it's something that's going to help out, for just your overall health.
Well, it's funny, when I'm off of them and I eat like a piece of fruit or something, I go, this is so sweet. Why am I? But I don't realize that because I've been eating all this chocolate and, all that kind of stuff. So that's the hardest thing for me. And with Christmas and New Year's and all this, it's just, it's so available. Everybody's got it out there. So let's talk a little bit about diabetes and heart failure. So in terms of diet and what have you, with diabetes, what is a good rule of thumb? What should we be eating and not eating?
Yeah, so basically with diabetes, it's something that you still want to have a balanced diet. You want to make sure that you have your starches. You're still allowed to have everything in moderation, but it's something that you want to go and make sure that it's just you're keeping your blood sugars under control. A lot of times people with diabetes, they check their sugars. They know exactly what the food's going to do to them. If it's something where it is a holiday or they're having a dessert, moderation on that stuff. Something where it's just, instead of having an entire piece of cheesecake, maybe have a bite or two or something like that.
Good information. Well, this has been really, really interesting. I'm so happy that you brought all this because I'm going to have this for lunch.
It's good stuff, yeah.
Yeah, we don't often have props. So this has been really, really interesting.
Awesome.
I hope you'll come back because I have other questions I would love to ask you.
I really enjoyed this. Thank you for having me.
Good. I'm so happy that you came. Thank you for tuning in to HealthWatch. I hope this information was beneficial to you and your family. If you're new to the area and you're looking for a physician, or you just need information about the services provided at Novant Health, please visit our website at novanthealth.org. We'll see you next time right here on HealthWatch.
So my owner tells me he's getting a home security system from Focus Broadband. Naturally, I remind him that he already has the services of a trained security professional. But then he tells me, security by Focus Broadband monitors against burglary, smoke, fire, and carbon monoxide. And you can get it all for as low as $20.95 a month. That's less than a bag of dog food. How am I supposed to compete? Maybe if I growl at the installation guy, he'll just go away.
Security by Focus Broadband. Peace of mind you can afford.